I'm Emilie Chambert, and I'm the country director for Living Goods in Uganda. So I want to start this morning with a story that unfortunately I did encounter in Uganda, in rural Uganda. I met this woman, Stella. She's 20 years old. She already had 3 children. Her last born, she delivered it about 2 months ago in a hospital about 5 kilometers from her home. The delivery went really well. She had a natural birth. On the same day, she went back home, then back to her duties on the same day. She managed to breastfeed her baby boy, and she was really happy to, after 2 girls, to have a baby boy. Everything was okay. Her husband was supportive. She was back into her routine. 4 days after delivery, her baby started to weaken. He was not breastfeeding well. She started to worry. The next day was the same thing. So she went to the witch doctor in her village. She got some herbs, really feeling that these herbs would make a difference. She gave that to her baby. After a day, the baby ran into convulsion. He really was in a bad condition. The next day, she rushed into the neighboring village to a drug shop to get something, a medicine, something. She wanted help. The drug shopkeeper gave her syrup. She gave this syrup to the baby. 2 days after, sadly, Stella's baby passed away. She did not have in her village a fully trained, equipped, supervised community health worker to support her with the right counseling, with the right support to identify danger signs. So at Living Goods, we support thousands of community health workers. So we're currently across Uganda and Kenya supporting 10,000 community health workers that are themselves supporting more than 8 million people, women, children in particular. And they're supporting them to really ensure that no one is left behind, that they get the right health support, that their families are healthy. And in the next few years, we hope to support thousands more across Kenya and Uganda and some other countries that we're currently scoping. So, thinking about community health, there are 4 fundamental pillars that we strongly believe in. Those 4 fundamental pillars, we've actually developed an acronym. We call them DESK, Community Health Workers. So what does it mean, DESK? So the D stands for digitally empowered. We want to ensure that there's data. E stands for equipped. You need to have a community health workers that is properly trained, that has the supplies, that has the essential medicine to save lives, that has the family planning methods that the woman wants. Then you want to ensure that they're properly supervised. They have a dedicated supervisor to support them. And then finally, they need to be compensated. None of us would work for free. Why would those people be volunteers? They need to have non-financial and financial support to keep them going. And so it is, imagine a table. If you have one of these pillars that is not in place, it is becoming wobbly. You need to have those 4 pillars in place to really make a difference. So at Living Goods, that's really what we're focusing on, is ensuring that those community health workers have really this ecosystem in place so that they can be functional. And today I'm going to talk a bit more about the digital component of it. We've talked a lot about data yesterday, and data and health are really linked and are very important to make this functioning. So in 2014, we partnered with a tech partner, Medic Mobile, to develop a powerful app focusing really on smart health and enabling community health workers to deliver health services. So every single community health worker that we support has an Android phone and loaded with an app. This is giving them a tremendous amount of power. The power to diagnose, the power to refer to a health facility for anything that they can't diagnose, the power to treat children that need certain treatment, the power to predict a delivery date for a pregnant woman, the power to target the household that most in need based on demographic or other data that we collect, the power to inform authorities, Ministry of Health, with what is happening down there in the community. So this is giving them a tremendous amount of power. You have these community health workers with all this different data that they collect. You have these supervisors that have then access to the data that are collected and that can really manage the performance of those community health workers. So now let's meet Rita. Rita is one of our community health workers supported by Living Goods over the last 4 years. She actually has been able to even talk at the last WHA assembly, and she's been trained 5 years ago. She's now able to assess sick children, treat them. Any children with malaria, diarrhea, pneumonia, she can diagnose them, treat them, and in case of danger sign or if for any other diseases, she's going to refer them to a health facility. Recently, she had a training on family planning. So now she's able to counsel women and girls in her community and to provide family planning methods if they wanted. Imagine Rita 5 years ago. She had a feature phone, but this phone was just to call her friends, sometimes to receive mobile money, but she had no idea that with a phone, she could gather so much data and really make a difference in her community. And I think when you move around in villages and with a community health worker like Rita, she's really having her phone and she's saying, this is my doctor calling from the US. And people really trust her. So it really empowered her even more than just a training. It is a different step. People trust her in her community, not just because of her phone. Of course, she has built this relationship, but this phone gave her additional confidence to really make a difference in her community. Her supervisor has access to a dashboard, and they can see how she's performing. What is she doing? Are there any areas where she needs more support? And then this is going to guide the supervisor in his daily activity to see, well, maybe to see what kind of coaching they need to do. How can she help, or he help Rita to overcome those challenges? And then the ministries, the subnational health team, they have access to this data. So now they're able to really disaggregate this data and look at what our communities like Rita needs. So empowering community health workers with digital health can really have a tremendous amount of benefit. The first one is really to improve the provider-patient relationship with real-time communication, accurate communication. It also improves the quality of care because you ensure that you have automated workflow that are following standards, protocols, and that when you have and you scale, and we talked about it with Chris earlier, it's not about having a couple of hundred community health workers. We're talking about thousands, and you ensure that all your community health workers are following the same protocol. So you're improving really the quality of care. But it's also about cost efficiency. You ensure that you reduce the cost for health system because you have efficient community health workers down there in the community that are able to do a lot of prevention work, that are able to treat simple diseases so that nurses and doctors in the health facilities, in the hospitals, can focus on more, complex cases. And this is saving lives. At Living Goods, we know through this, that through an independent research, we demonstrated that whenever you have a Living Goods supported community health workers, we manage to decrease under 5 mortality by 27%. So it works, it saves lives.